Okay.
Okay, so if both are ready and you have read and understood, kindly considering it history taking station, please begin.
Hi, my name is Ofeong. I'm one of the surgical doctors. Can I confirm your name and age, please?
Yes, I'm Andrew, 70 years old.
Oh, nice to meet you, Samrin. Please, can I get to know what brought you to the hospital today?
And doctor, I have been told that I have had seizures.
Okay. I'm so sorry to hear about that. Can you tell me how many episodes did you get to have?
Actually, I had two episodes. One of the episode was a month ago, and I recovered from that. After that, I had another episode of fits a week ago,
Oh, I'm so
and
sorry.
then I recently.
I'm so sorry to hear about that. I'm so sorry to hear about that. Please, can you tell me how did you feel generally before each episode?
I didn't feel anything.
Okay. Did you notice any
Like what, doctor?
unusual sound?
No.
Okay. Did you notice any visual changes, any flash of light?
Yes, I have had flashes of lights.
Okay. Did you notice any abnormal smell or abnormal taste?
No.
Okay. Can you tell me when the episode happened? Was there anybody around that saw when it happened?
Yes, there was a taxi driver. He noticed that my whole body was shaking, and he took me and he brought me to the hospital here.
Oh, that's a good information. So your whole body was shaking. Did he get to tell you how long each the episode lasted for?
No, he just brought me here and he left.
Okay. Did you get to know if you peed on yourself or you soiled yourself?
Yes, I peed in my pants. I thought my pants.
Oh, I'm so sorry to hear about that. Okay, did you get to notice that you was any loss of consciousness or did you black out?
Actually, I don't remember anything because I was not in my senses.
Okay, I'm so sorry. Okay, so can you tell me after the episode, how did you feel generally?
I just recovered.
Okay, did you notice any numbness or any weakness on any part of your body?
I didn't. I didn't look for that.
Okay, did you notice any visual changes, any speech problems after you recovered from the episode?
No, everything was all right.
Okay. So apart from the two episodes you had, have you had any previous seizure problems in the past, or fits, or having to shake in the past?
I just had one episode of shaking my whole body before this episode.
Okay. All right. Any trauma to the head recently?
No,
Have you noticed any headache, any vomiting?
no,
Okay. Any fever, or have you noticed any neck stiffness?
no.
Okay. All right. Mr. Have you noticed any unintentional weight loss or feeling very tired recently?
No.
Okay. Have you ever been diagnosed with any medical condition at all?
Yes, I have. I am diabetic and I'm also hypertensive, and both of the conditions are well controlled.
Okay. Good to know that. Have you had, apart from the medications and the sugar medications, are you taking any other medications?
I don't take any medication except that.
Okay. Do you have any allergy to any drug?
No, doctor.
Have you had any surgeries in the past?
No.
Okay. Have you ever been admitted for any health problems?
No, never.
Okay. Any family history of similar shaking problems or seizure episodes or seizure problems?
No.
Okay. I'm going to be asking you a lot more personal questions now. Okay. So, do you smoke?
No.
Okay. Do you take alcohol?
No.
Okay. Who do you live with?
I live with my wife.
All right. Can you tell me what you do for a living?
I'm a singer.
Okay. Okay, Mr. And can you tell me what do you think could be the cause of these seizure problems you've been having?
I have no idea about it.
Okay. Do you have any concerns?
Yes, I just want to know why I had them.
Okay. What are your expectations from us?
I just want to be recovered today.
Okay, can you please summarize your history?
Okay. In summary, I present a 67-year-old lady who presented today with seizure of 2 episodes. The first episode was about a month ago, and the most recent episode was 2 days ago. There was associated aura, flashes of light,
Yes.
and associated loss of consciousness, and no history of trauma. She's a non-diabetic and hypertensive, well controlled.
Okay, so what is your provisional and differential diagnosis for her?
Okay, my provisional diagnosis for her is likely space-occupying lesion, likely a brain tumor.
Yes.
I also consider infectious causes like cerebral meningitis or encephalitis,
Yes.
and then metabolic causes like hypoglycemia or alcohol intoxication.
Okay. What investigations would you ask for to confirm your diagnosis?
Okay, I would like to do a full blood count and ESR, CRP, inflammatory to rule out any infectious cause. I also like to do blood glucose to rule out hypoglycemia. I also like to do CT scan of the head to rule out any space occupying lesion.
Okay, what
And
treatment
then,
can you offer this patient?
okay, having in mind that I am likely suspecting a space occupying lesion, so I'll consider a first of all, my treatment to after I'll if the patient is having a current seizure episode, I'll make sure that the environment is safe, there are no sharp objects, and then I'll lie the patient in the lateral position to prevent aspiration, and then as I'll prepare for resuscitation as soon as the seizure episode comes down. Then immediately after the seizure episode, I'll start with ABCD of resuscitation. I'll make sure the airway is patent and patient is access for maintained breathing and circulation. And then I also abort any seizure with diazepam. Then I'll consider giving an anticonvulsant like uh, phenobarbital. And then if the patient continues seizing, in the case of status epilepticus, then I'll consider intubation and then uh, I repair and get to call my ITU or ICU consultant